upon the holidays, but your big toe shouldn't have Rudolph's red nose. What do I mean by that? Well, a fairly common condition that plagues people is one in which we have sudden onset of pain, most commonly in the big toe. It's a systemic disease causing that, and it's called gout. No one really knows why this starts in the big toe, because the problem involves excess of a substance in your blood called uric acid. It's normal to have that, but when those values rise too high, that substance crystallizes out in none other than your big toe. They even have pictures of the pharaoh, and they can tell by the description of what went on that the sudden onset of pain in there was gout. So what are the common signs of gout? Well, it's sudden onset of pain without injury and no other evidence of infection. It really comes on like a railroad train, and the pain levels are very high. It produces sensitivity that we call bed sheet tender. You can't even tolerate bed sheets on. On exam, it's tender to touch and tender at any attempt and motion. So even without prior history of this problem, if you have a condition with sudden onset of pain, it needs evaluation and treatment. Treatment initially is aimed at cutting down that inflammatory response. The body treats those uric acid crystals like a foreign body, and you know when you have a thorn, it's got to come out. This does not take any surgery. What it takes is taking a medication that will help your body excrete that uric acid and diminish your inflammation. Usually this takes a couple of days. The blood test for it is very simple, but sometimes that blood test can show normal and you can still have gout. The response to this one medication is almost diagnostic that the problem was gout. After the initial inflammation, you need to follow with your family physician and find out more about management of this systemic disorder.